Hello, my name is James Dixon, and today I have with me Alyssa Luck and Mira Suresh. Together we comprise a company known as JAM Consulting. This semester we were tasked by Delta Dental to make a final recommendation in terms of vertical integration, a strategy that they have been considering. To do this, we looked at some key questions. These included, what are the benefits and risks of vertical integration for Delta? What does a timeline look like for Delta Dental? So when would we start this process and what would it look like along the way? What are some potential threats that are arising from issues that are currently happening in Mexico, which we'll discuss in just a few minutes? How should this be funded? Are we going to look at venture capital, outside banks? Or is this something that we're looking to fund strictly with Delta Dental capital? Next, we'll look at how we would approach our network dentists that currently offer Delta Dental insurance that may take a look at this and believe that it's some form of competition that may come to arise. And how are we going to approach those dentists? Next, and finally, we'll take a look at legal issues, both state and federal issues. So to answer those questions, we broke down our presentation into some key categories. First, we're going to cover the executive summary, which will go over the objective of vertical integration, as well as a final recommendation. Next, we'll look at a marketing plan, a look at the risks, some possible blind sides, and legal issues. Next, we'll take a look at Mexico, what the issues that are going on there. An operational plan. We'll take a look at the finances, what's coming in terms of revenues, and then what would be going out initially as expense. We'll come up with a strategy, and finally, some milestones for success. How are we going to determine if this was a successful venture for Delta Dental? So we begin with the executive summary. As I mentioned, it's going to cover the objective, what vertical integration means for this company, and then our final recommendation. So the objective of vertical integration is a simple one. It's Delta purchasing dental practices. So whether that's, the ownership of dental practices. So whether that's purchasing new practices or building practices, whether the objective of,
Okay, start from the objective.
Sorry, guys. Okay. The objective of vertical integration is a simple one. It's the ownership of dental practices, whether that's the purchase of current practices or starting new practices from scratch. There's benefits and there's negatives of each of these, and those will be discussed. The goal behind this is an increase in both profit as well as market share. Our final recommendation is to pursue both profit and nonprofit segments. We do this because of some laws that we'll discuss later, as well as our ability to predict future revenues in specifically the for-profit segments. We recommend Delta to purchase established practices rather than creating new practices from scratch, with two major factors. The cost to start a new practice is much more expensive than the purchase of an existing practice, as well as existing practices already come with an established revenue stream, which will help pay back the initial investment much quicker than a newly established practice that does not have any form of revenue stream from the beginning. And lastly, we recommend a $36 million investment out of the $100 million currently available in reserves for Delta Dental. And we recommend this solely from Delta Dental rather than making use of venture capitalists, for the sole reason that a typical venture capitalist agreement is full repayment within 5 years, as well as a typical agreement to pay a profit of 100% of that initial investment, which, although this is a very profitable venture for Delta Dental, that would make this make it impossible for Delta to make use of venture capitalist money and still churn any kind of profit. Now I'm going to pass it off to Alyssa, where she's going to talk about the target market in the form of which dentists we will recruit for our practices.
Hello, my name is Alyssa. And a target market for this marketing plan would be recent graduates from dental school, mainly because they would not have the sufficient funds, experience, or knowledge of starting their own dental practice after they graduate. Another would be dentists who are underperforming, which results in not generating enough revenue. If these dentists are struggling to maintain a good practice, then they might be interested in vertically integrating with a dental insurance company. Another would be dentists returning from a hiatus, because if they might have a hard time starting from where they left off, and they might not be as skilled as they used to be. Last but most importantly would be dentists who do not want to continue as an entrepreneur. These dentists might want to continue working as an associate because they're passionate for their work, but they might not have the mental strength or willingness to do all the entrepreneurial duties. So from this, we recommend that sorry, I'm looking at the wrong notes. Working as an associate might be less stressful. Working as an associate might be less stressful because they would not have the burden of any managerial responsibilities. So for the dentist approach, we did interview a couple of dentists regarding the process of vertical integration with dental insurance companies. And as a disclaimer, we did keep all names confidential as we did not want to harm anyone's reputation or image. And we did leave out Delta's name as well. And from this, basically they said that they would not want to vertically integrate with a dental insurance company, mainly because they want the ability to be their own boss, control how much revenue they can generate, as well as be able to pave their own path as an entrepreneur. So based on this feedback, we recommended that entrepreneurial dentists would not be a part of the target market. Someone we did interview was a recent graduate who is currently working as an associate at a dental office, and we asked her the same questions, and she said that she would be a part of this model if it were implemented because it would give her more experience with patients and it would give her more knowledge, and it would also give her access to a mentor, and it would also help her pay off some student loans. The way Delta should approach the dentist in its network is by reinforcing the relationships between the dentist and the dental insurance company, because some dentists have a perception that dental insurance companies only care about money and profit. So if Delta were to emphasize the benefits to dentists and patients, maybe the dentists wouldn't feel as negative about this process. The benefits for the dentist would be that they would have more time to focus on their dental work instead of the administrative work. The fees would also be a lot cheaper for the patients, and they would have a steady pool of patients as well. They would also have a consistent salary throughout the year rather than depending on the revenue that's from the They would also have a consistent salary from the revenue that's generated from the individual patient services, and also from the operational expenses that are deducted from their revenue. And now here's Mary, who will talk to you about the competitors.
Hi, I'm Mira, and I'm going to be discussing the competitors of Delta Dental. So MetLife is one of the competitors, and they are a global insurance provider. They are Delta's main competition. They provide a variety of services, including annuities, as well as homeowners insurance, auto insurance, life insurance, as well as medical, pharmaceutical, and dental insurance. They have a variety of consumers appealing to retail, corporate, volunteer and workers' benefits, and they are present in 5 different continents. Founded in the mid-1800s, through the years of experience and resources, it's no surprise that they are the market leader. The next competitor is Aetna. They are a diversified healthcare benefit company, and their services include medical, pharmacy, and dental plans, as well as Medicaid healthcare management services and health IT services. Now, what's unique about Aetna is that they have also implemented a vertical integration process. However, it is very different from Delta Dental. Delta is an insurance company wanting to vertically integrate with dental practices that provide dental services. Now, what Aetna has done is integrated with Coventry, which is another healthcare provider. However, they provide a different range of insurances, and they dip their hands into a different pool of target markets. So what that's done for Aetna, it has increased their core range of services, diversified their healthcare plans, and it has also significantly broadened their global network. Both these competitors have taken risks to be leaders in the dental insurance industry. They have expected growth within the next 5 years, which is why it's especially crucial for Delta Dental to implement this vertical integration strategy to have a competitive advantage.
If vertical integration were implemented, a negative ramification would be financial loss because Delta would have to invest a lot of money into buying out these practices. If it were unsuccessful, the entire process would be entirely counterproductive. It would also harm Delta's image because it would show that Delta is not capable of implementing a new strategy that has never been done before. It's also very risky because if they were to vertically integrate with dental practices, many dentists could possibly leave and work for another practice. They might not like the corporate environment, or they might just want to continue as an entrepreneur. So the feelings of these dentists are very important to consider when implementing a new strategy in their field. The positive ramifications would relate to the financial gain and the company image. If vertical integration were successful, then Delta would be able to generate more revenue from the dentists that are working on the patients in a day. The dentist would have more time to focus on the patients, and the waiting time would be decreased as well. It would also boost Delta's image because it would show that Delta is capable of implementing a new strategy that no other dental insurance company has ever done before. This would make Delta the leader in its industry, and competitors would have a hard time mimicking them if it were successful.
So I will be discussing the blind sides that Delta Dental needs to look out for. Now, implementing a vertical integration strategy is not an easy task. There are going to be obstacles along the way. Now, JAM Consulting has considered all these potential impediments and is trying to prepare for any of these elements or hindrances to come about. First aspect is the legalities. Because vertical integration is a new concept, we want to ensure that there are no legal obstructions for Delta Dental to be paving the way with this new business model. The second is reformation in the industry occurring in Mexico. We wanted to identify what is exactly occurring in Mexico and if that process can transfer over to the United States. Is that something that Delta's competitors are capable and interested in doing? That would entail that Delta needs to act super fast or can take their time in integrating this vertical integration process. So when looking into the legalities, we considered both federal and state laws. And under federal, we looked at the U.S. antitrust laws. And these laws regulate the conduct and organization of business corporations, specifically pertaining to mergers and acquisitions. This law was implemented to instill fair competition and to also benefit consumers. Under this overarching law, there are three acts: the Sherman Act, Clayton Act, and FTC Act. These acts started popping up in order to address any gap issue problems that were occurring in the previous acts. In summary, these acts state that any merger or acquisition that became a monopoly was illegal, and it also empowered the FTC to prevent any merger or acquisition that had the potential to become a monopoly. So this was stated because if these companies became a monopoly, it could potentially eliminate the competition, and that would be, of course, an unfair competition, and it will also limit the choices that consumers have in the variety of products and services. Now, in state laws, we had to do a lot of research regarding this. Each state have different litigations regarding who can own or who can be a proprietor of a dental practice. There are two rules that apply to all states. First, nonprofit and professional corporations can be proprietors of dental practices. Now, professional corporations are very different from regular corporations. All members in a professional corporation needs to be licensed in that profession. Now, what that means is, for example, to own a dental practice, the professional corporation's members all need to be licensed in dentistry to own the dental practice. The second rule is that any member that does not have a license in dentistry may not affect the clinical judgment of a dentist. So, for example, if a nonprofit organization were to acquire a dental practice, they cannot affect or influence the clinical judgment of a dentist on what kind of care the patient receives. These laws were stated such that the patient receives the best care and is not profit motivated. Now, after doing a lot of research on the states, we grouped all the states that have similar laws, and we came up with 4 groups. There are 8 states that allow for corporate ownership of dental practices, and this is not, it can be any corporation. This second group are 2 states allow for, or don't have any relevant statutes regarding the proprietorship of dental practices. 2 states have very unclear laws about who can own or who cannot own dental practices. And the last group pertains to all the remaining states, whereby only licensed dentists and licensed hygienists are able to own dental practices. Delta is a registered nonprofit, under which it is a not-for-profit. There are 39 sectors that are nonprofit, and a few sectors are for-profit. That is an amazing combination that gives a lot of competitive advantage compared to Delta's competitors. Delta's competitors are both completely for-profit. So, thus, our recommendation for Delta Dental is to empower the sectors according to the state statutes. What that means is, for the states that allow for corporate proprietorship, that Delta empowers their for-profit sectors, and for the states that don't allow corporate proprietorship, that Delta empowers their non-profit sectors. So they cover all the states in the United States. So now to discuss about Mexico. What's currently occurring there? Well, a few entrepreneurs have gathered different dentists and have combined them to become a mega practice. On top of which now they are providing their own insurance, which is essentially vertical integration. Now what we want to find out is if this vertical integration process can occur in the United States, and how are we going to address that. So in the United States, the statutes prevent entrepreneurs from vertically integrating. At least that's the case for most of the states. So this is very unlike Mexico. The second is that Delta's competition are handicapped to vertically integrate due to the statutes of the states, meaning that since MetLife and Aetna are both for-profit companies, they cannot vertically integrate in a majority of the states. Now, what if a group of dentists decide to group together and start providing their own insurance? Well, JAM Consulting has considered this as well. Excuse me. And because this U.S. state laws prevent anyone that does not have a license to issue insurance, they are prohibited from issuing insurance. Now, the requirements to issue insurance are that first, you need to pass a very advanced exam. Second, there are extensive pre-exam course trainings, which means there's a bunch of classes that takes years to prepare for. And also, there are post-exam course trainings that every 2 years, insurance providers need to go to a class to update themselves on the laws and regulations regarding insurance providing. So this is all a huge disincentive for dentists to be licensed to also provide insurance. Now, one concern that Delta Dental should be a bit concerned about is the 8 states that do allow for corporate ownership, because that does facilitate their competitors to take advantage of that situation. To address this, we have also thought of a solution. Delta ought to pioneer this strategy in those 8 states. We want to direct more of our resources in those states so that their company is more established there. And this would give a stronghold on the competition. And on the meantime, we also want to slowly expand the nonprofit sector based on how much revenue and profit we're looking at. And now we'll be discussing whether we ought to have a separate division or a different company.
So Delta would continue the process of vertical integration through Dentegra, which is a dental plan that is targeted. Let me start over again. Delta would continue the process of vertical integration through Dentegra, which is a dental plan that is more affordable for an individual who's looking for something that is more affordable. It's only available in most states through the healthcare exchanges, and Delta would go through its for-profit segments in the states that allow it, and through the nonprofit subsections in every state. This would also be a lot less costly for Delta because they already have the established resources in those states. And it would also save them a lot of time because they wouldn't have to go out of their way to look for these dental practices to buy out. And now here's James who will talk to you about.
Oh, you should redo that though, because.
And now here's Mary who will talk to you about supporting additions.
So, to ensure a smoother transition for Delta to completely change their infrastructure, we thought of a few supporting additions to integrate into the team. First is the legal team to respond to any potential legal accusations or inquiries, because after all, this is a new concept. Also, we want to implement a public relations team to swiftly respond to any bad publicity or claims that Delta is being unfair in terms of competition, or unfair to the rights of dentists, or even the patients. The goal, the PR team's goal, is to remind everyone that this integration process is to benefit the consumers. It's supposed to make things easier for dentists, and also remind everyone that Delta still has its nonprofit goals. Another team is the B2B partnership marketing team. Now, they will be facilitating and negotiating partnerships and mergers with the dentists, entrepreneurial dentists. Another is the political connections. So for the states where they do not allow for corporate ownership, we want to slowly begin to change that and to empower the for-profit sector. Having a political connections could assist in doing that. And lastly, having an advisory committee of dentists. This is to address any potential backlash that Delta might experience from dentists or dental associations. This would accomplish what is best for everyone by making the best educated step, or what kind of actions that Delta needs to take. I'll be passing it off to James now.
Okay, so to take a look at the financial plan, the initial cost per practice is $714,000. That includes a purchase price of these already established practices of $375,000 and an annual operating cost for the first year of $339,000. Again, totaling the $714,000. Our initial investment, we want to concentrate mainly on the for-profit segment for all the reasons mentioned previously, both the illegal issues and then also the fact that we are unable to, at this point, project revenue streams for our nonprofit segment. At this point, there are not enough practices operating in the nonprofit segment for us to come up with realistic revenue projections. And we know and have the ability to predict these revenue streams for our for-profit segment. We want to concentrate mainly on this for-profit segment to make the return rate on our investment as short as possible. And we know that by year 3, we will already return our investment and begin seeing profits, which I'll explain in just a minute here. So again, we do want to explore the idea of nonprofit segment. We don't want to just forget about the fact that it's there, but we just don't know enough about it, so it's sort of an experiment at this point, and we do really want to explore the for-profit segments. This is what our 5-year plan looks like. Within 5 years, our adjusted net income per practice at the end of 5 years will be about $120,000. It's just going to be approaching $120,000. And our adjusted total income over the 5 years is $350,000 per practice. That incorporates the initial payback of the investment and then a $350,000 profit on top of that. At our break-even point of just at the beginning of 3 years, we want to review and reinvest our investments. So at that break-even point, we will already have repaid almost all of our full investment, and we want to reuse that investment as well as anything that we may feel beneficial to reinvest towards our for-profit as well as our nonprofit segments. This is a chart that kind of shows what I had recently, what I talked about in the last slide. We are approaching 120,000 in year 5, 118 to be exact, and this is in thousands. With the first 2 years in the negative, because we simply wanted to show that we could pay back our initial investment within those 2 years. So although there were revenue in that year, we used that revenue to pay back our initial investments, both in year 1 as well as in year 2. By the end of year 2, we are only negative $150, meaning we only owe $150 of that initial $714,000 investment, which gets taken care of at the very beginning of year 3, where we begin to see profits from 115 all the way to 118 in year 5, again with a total of 350 over that 5 years. For milestones for success, we wanted to take a look at what we felt were important to accomplish to make this a successful venture. What do we need to do to make sure that this whole process was for a real reason? And first, we want to take a look at the break-even point, which again was at the start of year 3. After that point, everything we've done produces profit. So we've already paid back our initial investment, almost like there was no cost, and we just see profits at that point. Next, an increase in market share. And how do we do that is through our ownership of these practices. We have a direct connection to a target market of consumers, those consumers that either have Delta Dental insurance already, which we can just deepen those relationships. Those that don't have Delta insurance and have a competitor, we will have a chance to interact. Our associates and our dental practice managers will have a chance to interact with those consumers and possibly change their attitudes and get them to convert over to Delta Dental insurance rather than the current insurance that they're using. And lastly, in our nonprofit sectors, we have an opportunity to reach people that possibly don't even have insurance. And we can work with them to create plans that are affordable for them that will also increase the share of the market for Delta Dental. So at this time, we hope that our recommendation was clear, our reasoning behind our recommendation was clear, and we'd like to leave you with a chance to ask us any questions. You can email them over or give us a call. I don't know. Okay, we're done.